Many times organizations go into the community and say, we're going to help, and here's the things that you need to get the help that you need. But what I appreciate about how HealthEast has becoming an anchor institution and trying to be in the community, they let the community help us shape what we need to work with them on. It's about giving them the tools, but also supporting them with the resources we have.
Community benefit is the way that nonprofit hospitals report back to the community at how we are giving back to the community. And in 2017, HealthEast had more than $80 million in community benefit. And this is in the form of programs, it might be services or activities. So for example, one of the areas of community benefit, because there's a huge need, is in the area of mental health.
With our neighborhood integration approach, we've really had to approach things differently. And that means starting with a sense of the context that folks have in our communities about engaging with healthcare generally. And so one group, the Eastside Mental Health and Stress Resilience Partnership, has formed. And so when we got this group together to ask them to think a little bit further upstream, they were really grateful for that opportunity.
We are beginning to think about how do we go upstream and look at mental health and resilience. How do we help our neighbors to become resilient to the issues that are creating mental stress for them? We have a pilot that we're working on within our St. Joseph's Hospital mental health unit. So we've identified patients who have severe and persistent mental illness and who are also homeless.
And the idea is to do what we call in-reach. So we reach into the psychiatric unit, meet the folks there, and I think it helps us because we then have a collaboration, for instance, with St. Joe's. Now the social workers know us, they know who to call.
I have a really good relationship with the social workers at St. Joe's. They call me regularly, probably every day. They've voiced to me before that it's hard when clients leave and discharge without somebody following their case because they've done all this work in the hospital, but nobody's kind of continuing in the community. So knowing that they have somebody that they can call to follow up on that has been really helpful for them.
There's more and more a realization of what all of us in healthcare have known for a long time, and that is that health doesn't have as much as we think to do with actual healthcare, that it has a lot to do with your environment and what we eat, what we do, exercise. So we believe that, to make a real difference, it's important to address those things and to step outside of the box, so to speak.
So we started working with HealthEast when we were invited by Blue Cross Blue Shield Prevention Center to apply for a grant that they had. And so I was thinking I would love to work with HealthEast in some capacity within this project.
They said, look, we've got, great vegetables here. You guys have people that need them. Let's get together.
And so we thought, well, this is fantastic. Let's do a VeggieX program, but let's not do it like it's traditionally done where, you just bring a box of fresh produce to a clinic. Let's actually think about who are the people that we're trying to serve and what are the real barriers to their access to healthy food and their access to just healthier eating.
I believe in the work that I'm doing here because I think we're all called to serve the greater good, and I feel it's the right thing to do because I didn't design this work and executives didn't design this work. This is a work that has been designed by a collaborative.
It's exciting to know that even as we're learning about how to create better health, it means that we're actually learning about how to create a stronger, fairer, and healthier community.
We can't keep doing healthcare the way we've done it traditionally. And we think that one of those tools will be to get upstream, to look at how do we leverage our healthcare system while we're still creating the best healthcare system that we can and providing very high quality healthcare. We need that. And that's what's fun. That's what's fun, to work in the community to look for new solutions.